Most beginners think a patient is just a patient. But in medical billing, not every patient is treated the same way. A new patient is handled differently from an established patient. An emergency patient is handled differently from a referral patient. And if you don't understand these differences, you will get confused during registration, billing, scheduling, and even claim submission. In fact, many billing mistakes happen because the patient type was misunderstood from the beginning. This is lesson 10 of my complete medical billing series, and in this video we are not just learning definitions of types of patients, but we are learning how the healthcare system organizes patients and why that matters in medical billing. Let's start with one of the most important types, the new patient. A new patient is someone who has never received professional services from that provider before or has not received services from that provider within a specific period, usually 3 years. Now understand this carefully. If a patient visited the clinic 5 years ago and is coming again today, they may still be considered a new patient according to billing rules. This is important because new patients usually require full registration, complete demographic collection, detailed medical history, more provider evaluation, and longer appointment time. From a billing perspective, new patient visits are often billed at higher levels because they require more work and documentation. This means identifying a patient correctly as new is very important for proper billing and reimbursement. Now let's talk about established patients. An established patient is someone who has already received professional services from that provider within the last 3 years. Because the provider already knows the patient and has existing records, the flow becomes faster and simpler. Usually, registration updates are shorter, medical history already exists, appointment time may be shorter, and documentation may be less extensive. From a billing perspective, established patient visits are usually billed differently from new patient visits, because in these cases, the provider is not starting from zero again. Now here is something important beginners often misunderstand. If a patient visits a different doctor within the same specialty and same practice, they may still be considered an established patient. So patient status depends on billing rules, not just personal assumptions. Now let's talk about emergency patients, one of the most important types in healthcare. An emergency patient is someone who requires immediate medical attention due to a serious or life-threatening condition. Examples include chest pain, severe injury, breathing difficulty, trauma, or heavy bleeding. Now, emergency situations work very differently from regular visits. In normal visits, registration and insurance verification happen before treatment, but in emergencies, treatment comes first. Why? Because saving the patient's life is the priority. From a billing perspective, this creates a unique workflow. Sometimes insurance information is incomplete initially, registration may happen later, multiple providers may be involved, and charges may become very complex. Emergency billing is often more detailed because many services can happen in a short time, such as physician services, lab tests, imaging, procedures, and medications. So emergency patients create a faster, more unpredictable billing environment. A walk-in patient is someone who comes to the clinic without a prior appointment. These patients are very common in urgent care centers, small clinics, and community healthcare facilities. Now, from a workflow perspective, walk-in patients create unpredictability because staff do not prepare for them in advance. The front desk must register the patient quickly, verify insurance quickly, and fit them into the provider's schedule. From a billing perspective, the process is usually similar to regular outpatient visits, but the operational workflow is faster and more flexible. Walk-ins are common in urgent care environments where speed and efficiency are extremely important. Now let's talk about Referral patients, a very important category in medical billing. A referral patient is someone sent to another provider by a primary care doctor or another physician. For example, a family doctor may send a patient to a cardiologist for heart-related issues. Now here is why this matters in billing. Many insurance plans require referrals before specialist visits. Without a referral, insurance may deny the claim, the patient may become financially responsible, and the provider may not get paid. This means referral management is extremely important. As a medical biller, you must understand whether a referral was required, whether it was obtained correctly, and whether the authorization is active. Because if referral documentation is missing, the claim can be denied even if the treatment was medically necessary. Now let's briefly understand another important classification. Patients can also be categorized as inpatient or outpatient. An outpatient receives treatment and goes home the same day. An inpatient is admitted to the hospital and stays for treatment. This distinction affects billing structure, claim type, documentation, and reimbursement rules. Outpatient billing is usually simpler. Inpatient billing is more detailed and complex because it involves longer care and multiple services. Now let's connect everything together. Different patient types create different workflows. A new patient requires extensive registration. An established patient requires updates and continuity. An emergency patient requires immediate treatment. A walk-in patient requires quick processing. A referral patient requires authorization and referral management. So even before billing begins, the patient type already affects documentation, scheduling, verification, coding, and claim submission. This is why understanding patient types is essential for every medical biller. Now you understand the major patient types in healthcare and medical billing. You know how different patients move through the system and how each category affects workflow and reimbursement. This understanding is important because medical billing is not just about claims, it is about understanding the patient journey from beginning to payment. If you are serious about mastering medical billing step by step, subscribe to the channel and turn on notifications. In the next video, we will learn about patient registration, demographic information, insurance cards, and the exact details you must collect correctly from the patient before the visit. And remember, the better you understand the patient journey, the better you understand medical billing itself.